Yes. Now, apart from, we are still under gram-positive cocci. Now, apart from staphylococci, we also have another type of group of bacteria we call the genus Streptococci. These streptococci are still also gram-positive cocci, but they normally appear in a strain like, in a chain like, you know, like you see this, these are chain like, chain, chain, hence earning the word strepto, chain like streptococci, but they are still also gram positive. That's it. These bacteria, they test what we call catalase negative. The kind of disease these streptococci can cause includes sore throat, rheumatic fever, scarlet fever, acute glomerulonephritis, pneumonia, tooth decay, and endocarditis. Those among diseases that are caused by this streptococci. Um, you may realize that this strepto can be classified in different ways. When we talk of Lancet classification, we talk about beta hemolytic strep. I would not want to go in those categories because it is more of a laboratory method of identification. But most importantly, is just to note that one of the common key pathogenic bacteria in the streptococci is what we call strep Streptococci biogenes. Is the most important of medical importance. It composed of an enzyme called hyaluronidase enzyme that is able to break down hyaluronic acid in the body that enables this bacteria now to spread so easily deep into the tissues. We have this hyaluronic acid um, in our cells that assist to resist the penetration of the bacteria. But now this bacteria is clever enough. It has that enzyme that breaks down this hyaluronic acid for them to move around. So among the diseases we generally suffer from this streptococci disease, we have what we call suppurative disease, where it produces a pus. Commonly, we have the otitis media, infection of the ears, cervical adenitis, peritonsilla abscesses, meningitis, pneumonia, cellulitis, embitical erysipelas, and those non-suppurative which do not cause production of pus is acute glomerulonephritis, rheumatoid factor, hematuria, edema, you know, etc. But the most common drugs used for treatment of strep biogenes is bacitracin and penicillin. That's an example of a patient having some strep disease. Um, so apart from the strep biogenes, we also have another species called Strep acalactia. Strep acalactia is also another common is disease, a bacteria that cause disease in the Streptococci genus. They normally commonly cause what we call neonatal diseases. Streptococci causes neonatal diseases in the children of onset. And then we also have strep viridans. Strep viridans is cause what you call subacute bacterial endocarditis. Inflammation or infection of the heart. Then you have pneumococcus, where we have this example of strep pneumoniae. This strep pneumonia is an encapsulated bacteria that causes what we call pneumonia. So in terms of diagnosis, just simply check for do gram stain, or for example, if it's sputum or culture, if you are targeting what we call, strep pneumonia, because the cough and the sputum will be there. Check if it's there, then check the sensitivity. This strep pneumonia is sensitive to what we call optocin. So, as I said, under Streptococci genus, the most medically important number one species is Strep biogenes. See, it has several um, conditions that we normally get from this Strep biogenes. It causes life-threatening infection of group A Streptococcus, including the following diseases. We have the scarlet fever, bacteremia, pneumonia, necrotizing fasciitis, myonecrosis, streptococcal toxic shock syndrome. These are among diseases that are caused by that. So when you talk of scarlet fever, where we have somebody who is really, almost every part of the body is experiencing, you know, um, body pain, the reddish eyes, you know, what we call increased density in terms of the body. The rashes are all over the body, and this with a lot of fever. This is a very dangerous, life-threatening disease. If we are not quick in terms of treatment, you can easily lose a patient because it's an acute epidemic childhood disease, which is characterized first of all by a sore throat. That's how it starts. Then, if there is no treatment, it moves to severe constrictional symptoms. It kind of blocking the trachea, and from there it moves to characteristic skin rashes all over the body, which is followed by exfoliation due to cyanothrogenic toxin. So these strep biogenes produce what we call cyanothrogenic toxin that peels off the body. After the rashes are there, then the body start peeling off. So if that's not enough, um, we have what we call streptococcal or septic sore throat, which is ulcerative inflammation of the throat with severe symptoms like high mortality rate. So this septic sore throat, that's how it happens. It really affects the sore throat, and a lot of it forms a lot of pus. They start swelling of the sore throat, and therefore it even constricts the trachea. The wheezing comes in because somebody is not able to quickly um, normally breathe, and therefore without if there's no proper. Yes, so when somebody has streptococcal biogeny, infection of the sore throat, if it's not quickly treated, it becomes so chronic and septic. A lot of pus around the sore throat. And you see that swelling is even constricting now the trachea, becoming small and small because of the swelling and the infection. It's really a very dangerous disease. If you don't quickly treat it, you can easily lose a patient, and more so is common in children. And because of the production of that, what we call cyanidogenic toxin, it can cause a lot of poisoning of these internal organs. That's how, just example of how the septic sore throat looks like, and therefore um, we must be able to quickly see how to kind of treat. Then we have when we call of erysipelas of the face. It's kind of the reddening and the inflammation of the face. Eh? See the nose of that man and the face quite red because of infection of the Streptococcus pyogenes. Erysipelas of the mouth, inflammation of the mouth, the tongue. Mm. Then that could be erysipelas of the extremities, where we have the legs, but the skin of the leg is seriously inflamed. You can think that somebody has been burned. Um, that inflammation of the cellulitis involving the hand, cellulitis of the abdominal wall, multiple coccal colonies observed on the surface of the exudates, embitical contention involving the buttocks still being caused by Staphylococci bacteria, rheumatic fever, a very serious fever, high fever, and it burns the skin. You might think that somebody, has been made burned by water, but it's because of this streptococci bacteria if not treated in early stages. This is the lungs where the glomerulonephritis, no, not the lungs, rather, the kidney, where now the kidneys have been inflamed. So we have those what you call localized infections, the meningitis, the meninges has been inflamed. Those white things, the brain has seriously been inflamed by this streptococci, bronchopneumonia. So the lungs have been affected. You know, we have the septicemia, the burning of the extremities. You know, this you might think is as a simple thing, but this bacterial infection is very serious. It can really scar your body, permanently if you don't take care of it. Peritonitis, inflammation of the internal organs, you know, if the bacteria is not taken care of. Yeah. So that one we were looking at the uh, two major gram positive cocci that we've looked at. Gram positive staphylococci, where we have several species of medical importance, Staph aureus and Staph epidermidis, then Staph saprophyticus, but major Staph aureus and epidermidis in that sequence. Then we have Streptococci genus. The most common there is Streptococcus pyogenes, Streptococci pneumoniae, Streptococci calactei, and all that.